NCSS has been supporting and guiding the social service sector for a long time now. In recent years, we've got another role, and that is sector developer. So together with that and our role as a membership organization for more than 500 social service agencies, we've really been trying to make a difference. In addition to improve the service delivery in the sector, we build capability and we encourage the community to engage themselves more, as well as to have corporate partnerships. That is how we can actually improve the quality of life of the persons whom we serve. And together we worked for a shared vision so that every person can be empowered to live in dignity and in an inclusive and caring society. So this roadmap charts the way forward as to how we can do this.
As a social service agency, there are multiple challenges, and one of the key challenges is actually our resources. People are our major resources, and having a sustainable and a competent workforce is one of the key to social service agency success. And there are a lot of technological innovations that we have done at AWA. We have modified toys for our children in the early intervention programs. And there was also an opportunity to participate in NCSS Sector Design Challenge and develop a solution. And that's how we came about developing this resource tool called DIRA for caregivers of persons with dementia to access information about dementia. And that's how we see these innovations. There is a direct impact to our clients, our staff satisfaction, where they have the opportunity to try out and improve their work. It also helps create a sustainable organization where the organizations are more efficient because the organization is solving its own problem. That is the true spirit of social services.
PSA has adopted the NCSS Sustainable Philanthropy Framework. I would say after adopting that framework, we actually have a more structural approach coming out with our CSR initiatives. So this framework is a good guide to shape and also track the outcomes of basically what we have done for all these CSR initiatives. Most of our staff, especially the frontline workers, they work on shift. Getting time for the staff to do volunteering work is actually quite a bit of challenge. We do things like giving our staff time off, giving the flexibility so that they can actually choose when and where they want to do a volunteering service through Help at Home, which is actually basically an initiative that we have started in 2015.
So my colleagues at the day hospice centres, they face various challenges every day, from ensuring the centre operations run smoothly, also to organise a wide array of programs and activities for our patients, to managing interactions with the patients, staff and volunteers. We created a training program. We include real-life case scenarios, issues that our colleagues at the Day Hospice Centre face on the ground on a day-to-day basis, particularly towards the volunteering matters. And so we thought that we need to have a more structured volunteer management framework so that we could also share this information with the colleagues at the day hospice to help them to engage the volunteers better and of course to lead to a higher volunteer retention rate. So we embarked on the NCSS volunteer management capability development, and one of the processes that we adopted was the volunteer role redesign. It was a process that helped us to identify the gaps, the improvements that we need to work on the volunteering roles, whether the roles are new or existing. It definitely helped us to review these roles and of course revise them accordingly to what suits our organizations and also our colleagues as well.
Whether it's augmenting your workforce with volunteers, thinking of innovative ways to do things, changing the culture of your organization to achieve this, I'd say never give up. Do it together. And that way we can really create a better place for all of us to be able to live together in an inclusive and caring society.